Assalamualaikum warahmatullahi wabarakatuh. First thing first, I will introduce my group member. We consist of 5 persons in a group, and first I will introduce myself. My name is NURAQILAH FATIHA. The second group members is RILDHIATUL AISYA. The third one is INSYIRAH. We have MUHAMMED ARIF FARHAN, and the last group members is MUHAMMED LOKMAN HAKIM. As we are from group 2, so the topic for our case study is critical success factors lead to the second Baldrige Award. So there are 2 questions. The first question is analyze the main focus of North Mississippi Health Services and MHS when it received a second Baldrige Award. So link our answer to the award criteria outlined in the notes. There are 6 main focus of North Mississippi Health Services and MHS in total. And the first one is workforce engagement and environment. So it enhances the workforce engagement and cultivating a positive environment. For example, we can see that NHMS invested heavily in creating a supportive and empowering work environment for its employees. So where are the evidence? So the introductions of a system-wide patient-focused improvement department in 2008 was a critical movement in involving frontline staff in day-to-day quality improvement. So the second main focus of NMHS is a core competency. So the organization's success was driven by the dedication and effectiveness of its workforce. So NMHS people were identified as a core competency. So it indicates their pivotal role in achieving and sustaining organizational excellence. So training, engagement, leadership development were emphasized to ensure a skilled and motivated workforce. The third main focus of NHMS is the recognitions. Recognitions of what? So recognitions of achievement. So becoming the first healthcare organization to win the National Baldrige Award twice in a row is an evidence, is a proof that they recognize an achievement. The next main focus of North Mississippi Health Services is sustaining achievement. So it focuses on maintaining and building upon previous successes. So an MHS ensured that its initial success in 2006 was not a one-time accomplishment, but embedding continuous improvement processes within its culture. So the empowerment of frontline staff to measure and drive success was a key element. Furthermore, challenges and credibility is also one of the main focus in North Mississippi Health Services. So the first award posed challenges in implementing the Baldrige Award, and winning the first award boosted their credibility and inspired ongoing improvement. So we can see that even though these organizations receive and achieve an achievement success, but they also face challenges. For example, they face staff turnover, loss of leadership to competitors, and the difficulty of moving from a good to a great performance level. So addressing these challenges involve renewed efforts in leadership, training, and employee engagement. The last main focus of NMHS is future goals. So committed to setting new goals and continuously improving high performance score is something that these organizations looking for. This is something that they are looking forward. So looking ahead, NMHS plan to set new goals which focus on scoring improvement and deeper integrations of the Baldrige principles. So the leadership expressed a commitment to achieving more challenging benchmark. So to summarize all these main focus of North Mississippi Health Services, we can see that all these main focus directly aligns with the Baldrige criteria.
Next is Baldrige Award criteria. The first one is leadership. NMHA senior leaders governed NMH's vision and governance, emphasized strong and ethical socially responsible governance. With their leadership commitment, it helped boosted workforce engagement and customer-focused culture. The second one is strategic planning. NMHAs set actionable goals and effectively allocated resources. They also focus on ongoing enhancement and setting new performance goals plus awards. They also successfully implemented and sustained the Baldrige criteria. The third one is customer focus. NMHAs prioritize the voice of customers to drive improvement. Customer focus influenced decisions including workforce engagement. We all know that NMHAs are linked with healthcare and ensure responsiveness to patients' needs are vital in healthcare. Measurement and analysis and acknowledgement management is number 4. They collected and analyzed data to track progress and inform improvement. They also monitored workforce and performance outcomes to sustain excellence. These efforts demonstrated strong measurement and knowledge management practices. The 5th is HR focus. High scores reflect strong HR practices aligned with strategic objectives. Engaged workforce directly enhances organizational performance. This results as position NMHS as a leader in workforce management within the sector. Number 6 is process management. They effectively identify and manage key value creating process. They also supported consistent and delivery of high quality healthcare. In result, process management and orientation was critical to achieving success. The last one is business result. This is pretty self-explanatory. The first one is they achieved strong outcomes in key performance areas, emphasized improvement across multiple categories, and this demonstrates holistic approach to excellent customers and satisfaction and also growth.
For the next question is, how is it possible to relate this criteria with Malaysian public hospital and polyclinics? We will explain more details on the next slide. For the first criteria is leadership. The Ministry of Health in Malaysia needs to provide a strong leadership and governance in the public health system. This includes establishing clear vision and programs that align with national goals. Second, evaluating the performance of health services. Third, ensuring the accountability among healthcare providers. Fourth, addressing systemic issues that affect access and quality of care. And lastly, developing leadership skills at all levels of the healthcare system. Top leadership in the Ministry of Health has played a crucial role in shaping the health sector ability to translate national goals into a cohesive vision for healthcare. By establishing clear vision and promoting collaboration among various stakeholders, the Ministry of Health has ensured that healthcare delivery align with national objectives, ultimately enhancing the quality and accessibility of health services for all Malaysians. For the second criteria is strategic planning. The government needs to focus on improving and refreshing healthcare services and focus on creating more ways to fund healthcare to make services better of a higher quality. The first strategy focuses on strengthening the healthcare system to prepare the country for crisis and new health challenges. This means improving hospital and clinic by adding modern facilities, creating systems that allow different healthcare services to share and access information easily, and investing in advanced medical equipment to provide a better care. This improvement will make it easier for healthcare providers to respond quickly and effectively during emergency, also enhancing everyday healthcare for the people. This strategy also ensures that patients get the best possible treatment with the latest technology and better communication across the healthcare networks. For the second strategy, which is focused on creating more ways to fund healthcare to make services better and of higher quality. The implementation of this measure will help create healthier lives, ensure sustainable healthcare funding, and improve the overall well-being of the people. This approach balances health improvement with financial stability, aiming for a better quality for life of the people. In strengthening health protection and healthcare financing, the Madani Medical Scheme will be implemented for targeted group as well as exploring new models to finance health facilities to improve the accessibility to healthcare services in ensuring that no one is left behind. In ensuring the availability of the best medical equipment for the people, efforts will be undertaken to address the issue of the high cost of maintenance and replacement of medical equipment due to rapid advancement in technologies. This new financial option will provide better financial flexibility, a cure with medical equipment with the latest technology for the benefit of the people. So that's all from me. I will pass the presentation to my friend, which is Aisha. Thank you.
My name is Aisha and I will move on to the next criteria, which is human resource focus. This focus emphasizes the importance of having a talented, engaged, and motivated staff that can help the firm in order to achieve the strategic goals. It is also aims to create a work environment that encourages employee well-being, contentment, and ongoing development. Human resource allocation for specialized or subspecialty service development will begin with the bare minimum and followed by a multitasking and gradual approach. This is to ensure that the realistic development of this specialized service, while it is also allowing for the extension of this service in order to satisfy the demands of the local community. Human resource planning and development also is one of a crucial thing in order to ensure that the healthcare professional possess the necessary skills and expertise in order to support the growth of advanced, for example, in surgical services. This also involve that they need a continuous training, skill enhancements, and ensuring that the workforce is actually well prepared in order to adapt with the new technologies and also a complex procedure. So, by focusing on the development on the healthcare teams, it is to ensure that to have a better patient care, smoother operation, and a workforce that feels valued and empowered in order to meet the evolving demand on modern surgery. Okay, so we move on to the next criteria, which is process management. Process management is basically emphasize the necessity of establishing, managing, and improving the process that are vital to the organization's missions and goals. So in healthcare, this is to optimizing both clinical and also non-clinical procedures in order to improve a patient care, decrease waste, and also boost the efficiency. As we can see in the simulation that made by some researchers, which are a decision making model of patient flow for improving patient throughput time in emergency department. So basically, this research is present a simulation based in decision making in order to improve the patient flow, especially in the emergency rooms. It is to enhance the patient flow by identifying the bottlenecks in operations, such as patient triage and treatment using a simulation approaches. By precisely modeling numerous aspects influencing the patient flow, this model assists the healthcare providers in making informed decisions that improve efficiency, minimize wait times, and improve overall patient care. The goal is to improve operational efficiency while maintaining a service quality in essential environments such as emergency department. This demonstrates that Malaysia hospitality system are working to enhance their management in order to suit the demands of their patients. As a result, it is clear that the process management is an important factor to consider in the hospitality in Malaysia.
So, for the customer focus, this criteria emphasizes the importance of understanding and meeting patient needs. The patient feedback system. Many Malaysian hospitals have implemented systems to gather patient feedback through surveys. This helps them assess satisfaction levels regarding waiting time and staff interaction and overall care experience. Community health programs that public polyclinic actively engage in community outreach programs that focus on local health issues. By involving the community in health education and preventive measures, This facility demonstrate their commitment to understanding and addressing specific patient needs. Next, we move on to measurement, analysis, and knowledge management. This area focuses on the systematic collection and analysis of data to drive decision making. Data-driven decision making that Malaysian public healthcare institutions are increasingly adopting electronic health record system. This system facilitate the collection of patient data, enabling better tracking of health outcomes and resource allocation. And for the performance metric, hospital have established the key performance indicator KPI to monitor various aspects of care delivery. For example, they analyze trends in patient admission to optimize staffing level and reduce wait time. Now let's discuss business results, which emphasize achieving positive outcomes in financial performance and operational efficiency. Financial sustainability initiative that public hospitals are exploring partnership with private entities for specialized service. This not only enhance financial stability but also improve access to advanced medical care for patients. Quality improvement project that many healthcare facilities have initiated. Quality improvement project aim at reducing medication errors or enhancing surgical outcomes. For instance, implementing standardized surgical protocols can significantly reduce complication and improve patient satisfaction. Thank you for me. Assalamualaikum.
Last but not least, to sum up our presentations for today, the Baldrige Award highlights excellence in leadership, strategy, workforce, processes and results. So NMHS second Baldrige Award underscore the importance of workforce engagement and strategic focus in driving success. So Malaysian public hospitals can adopt similar principles, strong leadership, strategic planning, human resource development and customer focus to enhance healthcare delivery, efficiency and patient outcomes. Thank you for listening and I hope everyone enjoyed our presentation just now.